Hello, and welcome to our video series on hypertensive disorders of pregnancy. This is the second video in the series. It will focus on what makes an individual at risk for developing a hypertensive disorder in pregnancy and what we know so far about preventing them. When talking about things that make someone at higher risk for developing high blood pressure in pregnancy, it's important to know that some factors can be changed or modified, but others cannot. Non-modifiable risk factors include a personal history of a hypertensive disorder of pregnancy in a previous pregnancy, a first pregnancy, a pregnancy with multiple babies, like twins, having gestational diabetes, age greater than 35 years old, Black and South Asian ethnicity, and having other chronic illnesses that predate your pregnancy, like diabetes or chronic hypertension. Having a family history of hypertension in pregnancy also increases your risk, so it is important to ask your family members about their pregnancy history. Though we cannot prevent these non-modifiable risk factors, it is important to optimize your health before pregnancy, which means good treatment of chronic illnesses, including blood pressure and sugars for diabetes. Be sure to ask your physician about your personal risk factors for developing a hypertensive disorder of pregnancy. One of the factors that can be modified is having a healthy weight before and during pregnancy. Most people who are pregnant can expect to gain weight throughout the pregnancy. The amount of healthy weight gain depends on your weight before pregnancy, so ask your healthcare professional if you aren't sure how much is the appropriate or expected weight gain for you. The best way to maintain healthy weight gain and reduce the risk of hypertensive disorders of pregnancy is by eating a good diet and exercising regularly. In terms of diet, it is important to make food choices that are high in nutrients. Calcium is one nutrient that has been shown to help prevent preeclampsia. Foods that are high in calcium include milk, yogurt, or fortified orange juice. You can also take calcium supplements if you aren't able to get enough in your diet. Other nutrients that are beneficial to have during pregnancy in general include vitamin D, omega-3 fatty acids, folate, and iron. Staying active is also important. Find activities that you enjoy and that are intense enough to raise your heart rate, or in other words, aerobic exercise. These can include swimming, cycling, dancing, and brisk walking. Aim for 30 to 60 minutes, at least twice per week, to decrease the risk of developing a hypertensive disorder of pregnancy. Depending on your risk for developing a hypertensive disorder of pregnancy, your healthcare provider may recommend that you take one baby aspirin each day. If taken after 12 weeks gestation, in people who have many risk factors, you can reduce the risk of developing a hypertensive disorder of pregnancy. As already mentioned, having a diet rich in calcium can also help to prevent preeclampsia. Your healthcare provider will be monitoring your blood pressure at your routine prenatal visits, and you won't likely have to monitor your own blood pressure at home unless advised to do so by your healthcare provider. Ask your healthcare provider if aspirin is right for you and what else you can do to help prevent preeclampsia. Check out our next video to learn about what symptoms to watch for and what treatments may be offered if you develop a hypertensive disorder